I mean, it hasn't burnt itself out, unfortunately.
I think we need to get on top of it more than we're doing now.
67% of Canadians would support a temporary nighttime curfew in their province to help control the spread of COVID-19. Now that's if the spread was serious enough and if public health officials recommended it. This according to the latest weekly survey conducted by Leger over the weekend.
Yes, I would have anything that would stop COVID-19.
Oh.
Difficult question. It depends on the circumstances.
I think short-term pain, long-term gain.
A nighttime curfew as part of a pandemic response.
Actually, I would.
I wouldn't think that'd be necessary.
Science is telling us, Dr. Henry and her team are telling us that we can manage this, in this instance regionally, over the next 2 weeks. And if these measures are inadequate, we'll look at other measures. That is how we've been operating from the beginning.
That survey also comparing the mood between Canadians and Americans on what the far-reaching consequences of COVID-19 will be. The top answer on both sides of the border will be long economic recovery. But Americans appearing quite a bit more optimistic, with far fewer listing economic recovery as their top concern compared to Canadians. We've had some announcements out of the U.S. and the U.K. over the past 2 days that are, some hope for optimism around a vaccine. Do you share that optimism?
I do. I think, it's still early.
I do.
I'm not optimistic or pessimistic. I'm hopeful.
I do share that optimism, but you need to recognize that vaccines normally take years to develop, and a catastrophe would be if all of a sudden there was bad outcomes because the anti-vaxxers would go crazy.
Now, in that survey, similar numbers of Canadians and Americans agreeing things like mental health, impacts to retail and hospitality, as well as healthcare will be most impacted. That cross-border opinion gap does open back up, though, for how many of us think the most far-reaching consequence of COVID-19 will be a generation of children forever changed by the pandemic.
It remains a huge problem.
We're probably kind of hitting the worst point.
I think it's getting out of hand.
Being winter and the season of flus and colds, and people being more indoors, I'm not so sure that we're actually going around the corner. I think it'll take a little more time. Probably, my guess would be spring, summer 2021.
In Vancouver, David Zura, City News.